A few weeks ago, I was having a discussion with a patient about her upcoming cataract surgery. And of course, we talk about the different lens options that can be placed at the time of surgery. And she said to me, "I just want the clear lens, please." To me, that left me a little bit confused. My thought as an ophthalmologist is they're all clear. All the different types of lenses are clear. But I think that also points to just an underlying misconception about the lenses that we put in with cataract surgery altogether. What she went on to tell me is she wanted the lens that was covered by insurance. And although that lens is clear and all the lenses we put in are clear, I think she had the understanding that it was just a clear lens that we're putting in, whereas really it's a very highly specialized lens. Even the standard lens, the monofocal lens, the power of that lens is custom chosen for that individual eye. The right eye gets a specific power and the left eye gets a specific power. Confusion that I see quite often where people don't really understand what it is that's being done with cataract surgery and the type of lens they're having placed. Some people will say they want the distance lens or the near lens. Well, there really is no distance lens or near lens. It's the same type of lens. We just choose a different power to make your eye focused at distance and a different power to make your eye focused up close. And that power will be different for each individual patient. One patient may get a 21 diopter lens, and that lens will allow them to see very well for distance. And one patient will get a 21 diopter lens, and that patient will allow them to see very well for close. There's not a distance lens or a near lens per se. There can be a distant outcome or a near outcome. So when someone has cataract surgery, when we do cataract surgery, we remove the lens inside the eye. That lens that you're born with, that you've had your whole life, is a very powerful lens. It focuses all the light coming in from a distance and focuses it over a very short distance, the length of your eye. So over a distance that's typically less than 20 millimeters or so, 2 centimeters. So if we're focusing all that light over such a short distance, it takes a very high powered lens to do that. And when we take out your lens, and let's say we didn't put a new lens, then the light would be very unfocused. Before the invention of intraocular lenses, before the routine use of lenses inside the eye, patients would get glasses afterwards. But not just any glasses, they would get what we call aphakic glasses, really thick glasses that people would wear after cataract surgery. And they would see quite well with those. But the power of those lenses, those magnifiers are about 8 diopters or 10 diopters or 12 diopters, depending on what the shape of that eye was. So very thick glasses, and without them, patients couldn't see distance or near. They required those glasses really all the time. So the invention of the intraocular lens and being able to put a lens inside the eye, a very high-powered lens inside the eye, really was a huge advance when it came to cataract surgery and how patients saw and the quality of life for patients after cataract surgery. So how do we figure out what power to put inside someone's eye with cataract surgery? That's usually the preoperative visit, or some practices will call it the biometry visit. The two main variables that determine that, there are many different formulas and many different variables that go into formulas, but the two most important variables are the curvature of the cornea, the front part of the eye, because that also focuses some of the light, and then the length of the eye. We use the curvature of the cornea and the length of the eye to estimate where that lens is going to sit inside the eye, the new lens. We call that the effective lens position. If you're able to figure out the effective lens position, how far that lens is going to be sitting from the retina, then you can choose the exact power for that lens in order to have the light be focused right on the retina. If you want light coming in from distance 20 feet and beyond to be focused right on the retina, you'll choose a certain power for that lens. If you want someone to be focused up close, you can choose a power to have them be focused up close as well. So the biometry visit, or the preoperative visit, is what allows us to know what power lens to put inside your eye. When it comes time for you to be choosing what type of lens to have placed inside your eye with cataract surgery, think about how you want your vision to be when you're not wearing glasses. Do you want to be able to see distance well without glasses? Do you want to be able to see up close well without glasses? Do you want to be able to see both distance and near without glasses? Or do you simply just don't mind wearing glasses all the time, and if you're not wearing your glasses, the vision's out of focus, it doesn't bother you? All those things thinking about will help you have a more informed discussion with your surgeon when it comes time to choosing the type of lens to have placed inside your eye. One more note about this issue. If you are accustomed to seeing well at distance without glasses, and I've only had to wear glasses for up close, but now your distance vision is starting to fade and you need cataract surgery, there's nothing about you having seen well for distance through your whole life that means you're going to see well for distance after cataract surgery. We're removing your lens and we're putting in a new lens. How you see after cataract surgery will depend entirely on the power of the lens that we place inside your eye. Same thing for up close. If you've been used your whole life to being able to see up close well, but now your vision is getting blurred because you have a cataract, there's nothing about your eye that makes it so you're going to be able to see up close after cataract surgery like you had before. We're removing your lens. We're starting with a blank slate. How you see after cataract surgery depends entirely on the new lens that we put inside your eye. And that's why it's important to think about, and that's why it's an important discussion to have with your doctor. I hope you found this useful. We kind of covered a lot today, but it's a very important topic to, whenever you have cataract surgery, to understand what really is involved. We're removing your natural lens. We're starting on a blank slate. You're going to need a very high-powered lens placed inside your eye. That high-powered lens can be chosen, a power can be chosen for distance vision or for near vision. You can have a multifocal lens, which allows you to see both distance and near when you're not wearing your glasses. Important stuff to think about before you meet your surgeon, and also after you have your discussion with your surgeon. If you have questions, it's important to think about that and come to a decision before you actually have your surgery. Have a great day. We'll see you soon. Did I mention that I wrote a book about cataract surgery and what to expect before and after cataract surgery? You'll find it in the link below.